Ventilation. Ventilation is the movement of air in and out of your lungs. We describe this as minute ventilation. It's very similar to our cardiac output. Remember cardiac output, which was heart rate times stroke volume. Minute ventilation is flow times the tidal volume. So we have number of breaths per minute times the number of milliliters of air moved in and out, approximately 500 mils. So 15 breaths per minute times 500 mils, that's approximately, or that is 7.5 liters per minute. That's essentially our ventilation. We can quantify it. But it has to do with, there is some things that are important to think about with ventilation. One of the main things is Boyle's law. Boyle's law has to do with pressure being inversely proportional to volume. So that means any change in volume, if we increase volume, we're going to decrease pressure. If we increase pressure, we're going to decrease volume. Increase pressure, decrease volume, and opposite there. So we have two conditions that we need to consider when we're talking about ventilation. Expiring air and inspiring air. Breathing in and breathing out. We have our lungs, our left lungs and right lungs, two different cases. And our job on expiration is to move air out. Our job in inspiration is to bring air into the lungs. So we accomplish this two different ways. So what we want to be able to consider is that the job of the respiratory system is just to get air in and out of the lungs when we're looking at just the mechanical ventilation. So when we look at expiration, we look at it from the aspect of we're going to decrease the volume inside the chest cavity. And when we decrease the volume, we're going to increase the pressure based on what we just talked about with Boyle's law. This is going to force air out. Let's put arrows this way. Air out. So we also have some muscles that deal with this, the internal intercostals, as well as the abdominal wall contract when we exhale. The diaphragm relaxes. So when we want air to come in, air in, we need to increase our volume, expand our chest, increase volume. And then this is going to increase or decrease our pressure. So our diaphragm is going to contract and it's going to open up the chest cavity. It's going to make more space, increase our volume. And this is accomplished via our diaphragm as well as our external intercostals at this point. So essentially the air in and out, the resistance is controlled by the smooth muscles that covers all the bronchioles, your trachea. So increasing or decreasing the radius of these tubes is going to control the amount of air in. So we get this accomplished via two different mechanisms. Similar to what we had with our heart, we have a sympathetic control. That's epinephrine. Epinephrine is going to bronchodilate. When it dilates, it's going to decrease resistance to the air entering. So the air will get in easier. So that's what we can call increasing our airflow. On the other hand, our parasympathetic, remember in the cardiovascular system, the parasympathetic was charged with keeping the heart rate down. Our intrinsic pacemaker potential at the SA node was 100 beats a minute. When parasympathetic control was overtaking or was driving the heart rate, we would keep it around 60 beats a minute. When we exercised or got scared, the sympathetic would take over and increase our heart rate. Similar things happen in the respiratory system. Histamine as well as nicotine are going to bronchoconstrict. Bronchoconstrict is going to feel like you have asthma and make it hard to breathe. So it's no secret that when someone's having an allergic reaction to something and they give them an EpiPen, the EpiPen is going to bronchodilate, decrease the resistance, and allow more airflow into the lungs. In this case, bronchoconstrict, we're going to increase the resistance. We're going to make it harder